All right, in this video, I'm going to give you the big picture about personality disorders and give you a bit of an overview of them. So if you really think at a broad level, when we're talking about personality disorders, we're talking about disorders that are not temporary, but are really all-encompassing in a person's life. And there's two main ways that these exhibit themselves. Obviously, the specifics can vary for the personality disorder, but these are the two main areas of functioning that we're talking about. The first one is interpersonal difficulties. How a person relates to another person is often disrupted with personality disorders. So they will get under the skin of another person or have difficulty connecting with other people, or there's just some form of difficulty in how they relate with others. And this is not specific other people. This is not just temporary. This is really a chronic pattern in their life. So that's one. The second main feature is actually the way that they view themselves. So you could call this the intrapersonal, how they relate to themselves. Because people with personality disorders often have issues in regards to how they understand themselves, their sense of who they are. Oftentimes they will say, I don't know who I am, or they'll act as if they're entirely defined by the opinions of others or some other thing like that. So those are the two main clinical features of personality disorders. Now, the DSM-5 actually gives a framework for talking about personality disorders. And so when they're talking about these, they're really referring to enduring and chronic patterns in a person's behavior. So it needs to be pervasive and inflexible. So pervasive in the sense that it's a pattern that occurs in different relationships and different contexts, and it's inflexible. So it's not just a way of acting. So a person could potentially act in certain circumstances like a narcissist, and yet the other circumstances they don't do that. So that's flexibility. We're talking about inflexible. They cannot help but behave this way. It needs to be stable and of a long duration. So they need to have this problem for a number of years. These are not short-term disorders. There needs to be clinically significant distress or impairment in functioning. So that's two parts. It needs to cause them distress. It needs to bother them and concern them. Or if it doesn't concern them, it needs to at least impair them in some way. So impair them in how they go about their job or about their relationships. It needs to cause friction or problems, and it needs to be manifest in at least two areas. So it could be work environments, friendships, education, these different realms of life that we have. And so so those are the bigger picture. Whenever you think about, oh, does such and such person, or do I have a personality disorder, I think this raises the bar. This says this is not just a minor issue. This is going to get your attention. So oftentimes I like to, and I've heard others say the same, distinguish between traits of personality disorders and actually having a personality disorder. So I encourage you to be cautious about putting a label on yourself or anyone else around you that maybe you'll just be liable to have a confirmation bias and see them only through that label. Okay, so for personality disorders, they've been, now DSM-4 gave us this framework. DSM-5 doesn't make any mention of it, but I think it's helpful to kind of organize it. So there's actually 10 personality disorders, and you can cluster them into three categories. They call it cluster A, cluster B, and cluster C. Cluster A are the odd or eccentric behaviors. So we're going to talk about schizoid personality disorder, schizotypal personality disorder, and paranoid personality disorder. Cluster B are personality disorders characterized by dramatic, emotional, or erratic behavior. And so we'll talk about antisocial personality disorder, borderline, histrionic, and narcissistic. And the third category, cluster C, is fearful or anxious, and this is dependent, avoidant, or obsessive compulsive personality disorder. And so, again, that's the big picture for these personality disorders. Lastly, I just want to mention the prevalence. So you'll see here that when they've estimated the lifetime prevalence, it's somewhere between 4% and 15%. Now that's a pretty big gap. It seems to be that this is a hard thing for us to really measure. Personality, it's one thing to measure symptoms of a person's mental condition in terms of feelings of sadness or anxiety or eating disorder behavior. It's harder to measure a person's personality. And so that's why you get such a big gap here. So it's between 4% of the population and maybe about 15% of the population has this. And these tend to go along with other disorders. So there's about 75% comorbidity. In fact, many of the personality disorders overlap. And that's one of the challenges, but they're also associated with depression, anxiety, substance use, and a lot of other related problems. So high comorbidity. Now, again, for estimating prevalence, this is a difficult task. The reason is the diagnostic criteria. So DSM-5 didn't actually make all that much of a change from DSM-4, which struggled to sharply define what is it that we're talking about when we're talking about these disorders, paranoid personality disorder or histrionic personality disorder. The terminology is kind of vague, and so that makes it a little bit difficult to say, okay, does this person have it or not have it? The second problem is that the diagnostic categories are not mutually exclusive. So we'll talk about people who don't have concern for other people, and that's something that's evident in antisocial personality disorder, but it's also evident in histrionic personality disorder and in borderline and in narcissistic personality disorder. And so there's a lot of overlap in our understanding of these. And that makes it kind of difficult to say, oh, do they have this or do they have that? Well, oftentimes it's not clear cut. And lastly, the challenge is that personality is not an either or, it's a dimension, it's a continuum. And so if you are trying to determine whether a person has a personality disorder, it's hard, especially if they're on the sort of fence of this. Are these problems bad enough? Well, they can certainly cause some problems, but are they bad enough to have a diagnosis for them? And that makes it, again, kind of difficult to tease it apart. Okay, so this video unpacked the prevalence, the big features of these disorders, and talked about the different clusters. And in the next video, I'll talk about the different types of cluster A personality disorders.